deficiency. So let's talk about now disorders. PDH deficiency present as congenital lactic acidosis, right? So what is congenital lactic acidosis? It is due to the defective PDH enzyme or inactive PDH enzyme. Now I told you that the activity of PDH is dependent on various coenzymes, the 5 coenzymes we have discussed. But out of them, thiamine is the most important coenzyme, right guys? Because that is the first coenzyme required for the reaction. So thiamine deficiency has been linked to the inactivity of PDH very commonly. Fine. So that is why the congenital lactic acidosis may be caused just by thiamine deficiency. Fine. So what happens in congenital lactic acidosis? See guys, now the PDH is not present or it is inactive because of thiamine deficiency. Pyruvate is not converted into acetyl-CoA. So now pyruvate converts into some other pathway, right? Let's say it is making the lactic acid via LDH, or it is also making alanine via ALT reaction, alanine transaminase reaction. So what happens to this patient? If you do investigate this patient in the blood, you will find large quantities of lactic acid. So this patient presents with lactic acidosis. So there is high quantities of lactate, high quantities of alanine also, right? Which is also very important investigation. Now as this alanine may be used in gluconeogenesis, right? And that's why this patient may also have high blood sugar, hyperglycemia. Fine. So that is the basic presentation of this patient. Guys, this disease can be X-linked dominant, means both boys and girls are affected. X-linked dominant pattern of disease. Right? In X-linked recessive, you know that only girls are manifesting the disease. Like only boys are manifesting the disease, not the girls, right? Now, next point is, guys, how will you treat the PDH deficiency or the congenital lactic acidosis? So you can give high dose of thiamine, number one. Second thing, what you can do is give the less amount of carbohydrates, right? Or we can start ketogenic diet. Guys, what is ketogenic diet? Ketogenic diet is a diet which is having very less amount of carbohydrates but very large quantities of fats and proteins. Fats especially are very high, right? Because fats can make ketones. So why we are giving this type of diet? Basically what we are trying to do is we are giving ketones as a source of energy, but we are removing carbohydrates. So why you want to remove carbohydrates? Because that is causing the lactic acidosis now. So that's why remove the carbs and increase the fatty acids in the diet, and that is called as ketogenic diet. So this can improve the patient's condition apart from giving thiamine, right?